On the Health Beat this morning, there's new research on concussions among high school student athletes. The top 3 sports for concussions: football, girls soccer, and boys ice hockey. Dr. Elizabeth Pieroth, director of the Concussion Care program at Midwest Orthopaedics at Rush, is with us to talk about this new research. Doctor, good to see you. Good morning.
Thanks for having me. Good morning.
I want to back up here just a little bit. As a parent, how do you know if your child has had a concussion?
So there are things we want to look for. So there are what we call signs of concussions, and those are things that are observable by others. So they look confused, they're slow to respond to questions, they're walking and they're wobbly, their balance is off, or they're reporting symptoms of concussion. And those are things like headache, nausea, dizziness, sensitivity to light and sound, fatigue, or oftentimes kids will talk about feeling confused, foggy, out of it. All those are symptoms that raise concern that a concussion may have occurred.
Got it. I want to go back to your research here, and we mentioned this: football, girls soccer, boys ice hockey have the highest rates of concussion. Any idea why those 3?
So those are high contact, high collision sports. And so just by the nature of the way the game is played, there's a lot of contact. But I will tell you, we also see a lot of concussions in wrestling and lacrosse, as well as non-traditional things sports you think of, like basketball, cheerleading, and volleyball. I have seen concussions in golf and swimming and tennis. So we know that these injuries can occur across sports and certainly in non-sports activities as well.
Yeah, I'd be the one to get a concussion while playing golf. What do you say to parents whose kids play these sports, especially the contact sports that you were just talking about?
So there's a couple of things that we tell parents. Is one, you really want to talk to the coach to make sure they're creating what we call an environment of safety in concussion recognition. Are they encouraging athletes to come forward versus hiding symptoms? The last thing we want to do is have an athlete continue to play if a concussion is suspected. Do they have safety protocols, not only for concussions, but other things like spinal cord injuries or heat, heat and hydration, sudden cardiac arrest? Are they teaching athletes how to properly follow the rules? Are the officials consistently applying those rules? So the good thing about all the research over the last couple of decades on concussion is that we have found ways to reduce these injuries, although there's always a risk involved in any of these sports.
Right. So many things that we can do as adults to keep an eye on our young people. Dr. Pieroth, good to see you, and thank you for your research and your time. Appreciate it.
Thank you so much for having me.